Standardized tests play a role in medical education, but to me, they sort of create this fantasy world where they give you all of the clues that you would need in a case to solve it. They skip over steps one and two, which is knowing what information is important to acquire and having the skills to acquire that information. They assume that you have those first two steps, and they give you all the clues. They tell you that the patient traveled to India last month, that there's an S3 Gallop on exam. In the real world, in reality, patients don't come to you with signs saying, I traveled to, Africa last month, or I have an S3 Gallop, listen right here. They don't do that. So the clinician has to, number one, identify that travel history is important in this case, gather that history. In the example of the S3 Gallop, the clinician has to, number one, understand that the heart exam is important in this case. Number two, has to be able to listen to the heart properly. Number three, has to be able to recognize the S3 Gallop. And number four, has to synthesize that S3 Gallop into the case and understand how it affects the case and the diagnostic, the differential diagnosis. And so it's really multi-layered. And this is why computers will never replace clinicians. I think we can all imagine a world, and it may already exist, where there's a machine or an instrument and you input information into that machine and it will output a diagnosis. Someone has to gather the clues that goes into that machine, and that someone is a clinician. So clinicians will always have a role in making a diagnosis and in patient care.